Now the vaccines, this has obviously been part of the big news in the last month. Brad, could you go to the next slide? Thank you. It's been a remarkable accomplishment, and we've heard so many superlatives and hyperbole with this disease, and it's unprecedented, but this truly is a remarkable accomplishment, going from an unknown viral particle and creating a vaccine that actually works and is safe. And we'll talk a little bit about how that worked. The protein spike, the little red spikes on that lower right hand viral particle, that's the key to most of these vaccines. You've got to present this protein to the body's immune system, and it creates antibodies and immune cells that attack that protein and destroy the virus. There are a number of vaccines in development. The two that you've heard of the most are called messenger RNA vaccines by Pfizer and Moderna. And Dave Kaufman, who's taking over as VPMA, noted that Moderna ends in RNA. I didn't notice that, but this company was started several years back. And the idea of a messenger RNA vaccine is not new. This company's been working on this for years, but it's never been used in humans before. There's also vaccines under development that are using DNA, again, trying to produce that protein particle. Traditionally, vaccines are taking those protein spikes and sticking them on a benign virus or a benign bacteria or some type of inert substrate and injecting it into the body. Another common way of making a vaccine, like what we get with the flu, is taking influenza virus, growing it, and then treating it so that it can't infect you, but all the particles on the outside will stimulate the immune system. So there's all these different ways of making vaccines, but the messenger RNA is something that's never been done in humans before. Next slide, Brad. The vaccines can be delivered in a variety of ways. We've all experienced the flu shot, the injection, but one of the vaccines is trying transdermal or skin, where you wear a patch for a few days and the vaccine enters the body that way. One manufacturer is trying to come up with a pill. Another is working on a nose spray. The manufacturing is a huge hurdle. There's like 6 billion people on this planet. There's over 300 million in our country. Going from 0 to hundreds of millions of doses of vaccine is an incredible task. And the vaccine manufacturers, while they were running these trials, have been gearing up the infrastructure in the background to make these vaccines. So as soon as they get the green light, they'll be able to distribute up to 20 to 30 million doses, which is an incredible undertaking when you realize that this whole thing just started a few months ago. The distribution of the vaccine is another hurdle. The messenger RNA vaccines require that they be distributed frozen. The Pfizer product has to be stored at minus 70 degrees Celsius. The Moderna is minus 20 degrees Celsius. So this is another distribution nightmare, but they're meeting it, and they're coming up with distribution channels already so that the 30 million doses are going to be distributed as they're.
Did we lose Bill's audio?
Yeah, I think somehow I got muted, but I think I'm unmuted.
You're unmuted. Sorry about that.
There you go. The safety of the vaccine is obviously crucial, and that's been, from day one, been part of the analysis as they've gone through phase 1, 2, and 3 trials. And the messenger RNA vaccines have been incredibly safe. And finally, they need to work. When this all started, if they could have come up with a vaccine that was 50% effective or better, that would have been a success. Both of these messenger RNA vaccines are 90 plus. In fact, the latest research is around 94% efficacious, which is incredible. And even the 6% that got COVID, their disease was attenuated. Nobody got as sick as people who did not get the vaccine. So really incredibly successful. One of the open questions is, how long will this vaccine last? We don't know yet. It's so new. We're going to need to be watching that carefully over the next several months to maybe a year or two. Next slide, Brad. So early on, as we know, this COVID-19 was found in Wuhan, China, and literally within a few weeks, the RNA of the COVID-19 virus was sequenced, and very quickly, literally within weeks, they were able to identify the segment of RNA that coded for that spike protein, that red protein on that diagram in the upper right, and here it happens to be blue. Then what they did in the laboratory is they took that piece of RNA and they added some stuff onto the ends, both the end and the tail, the beginning and the tail, and they created what is called a messenger RNA. This is a piece of RNA that we actually use in our own cells to take the genetic information in DNA. It's made into messenger RNA, and then it goes into the cell where the protein is actually made that is coded in the DNA. So the RNA inside that cell of the COVID was turned into a piece of messenger RNA. Next slide, Brad. So again, this technology exists in the lab. It's been around for years, but it's never been turned into an actual vaccine that had been deployed in humans. That messenger RNA is the connection, and what happens is it gets run through what's called a ribosome, and that makes a protein. And every protein that we have in our body uses the same mechanism, the same machinery. What is happening is we are essentially making our own vaccine. We're not injecting proteins, we're not injecting dead viruses or attenuated viruses. What's being injected is a piece of messenger RNA that is then used by our own cells to create that protein and stimulate our immune system. There's nothing infectious. We have DNA. It's not going to get incorporated into our DNA. The messenger RNA does not last for more than a day before it's degraded. And this whole process from taking the code from a COVID RNA and creating a vaccine was 42 days. It's unbelievable. Next slide, Brad. So this is kind of how it works. They took that little RNA, which is the blue, they tagged each end to turn it into a piece of messenger RNA that our own cells would recognize. They put it in a little, what's called a liposome or a fat globule. They put a few little receptors on the surface of that. They inject it, and those receptors hone in on the lymph nodes. Next slide, Brad. Once it gets into the lymph nodes, into those cells in the lymph node, it's incorporated into the cell, and that's where our own machinery takes over, turns that messenger RNA into protein spikes that make their way to the surface. And next slide, Brad. And those, the red and the yellow, those are our own immune cells that are now identifying that protein that our own cells made as a foreign body, and we're creating antibodies, and we're creating cells that will now identify that as a foreign body. And if we ever do get a COVID infection, it will destroy those cells pretty quickly. Or if you're that 6% that do get an illness, it's going to be markedly attenuated. So that's, next slide, Brad. That's the story of the messenger I get excited every time I give this talk. It's pretty remarkable what has happened. It's never been done. And to use our own cells to create the vaccine is just, it's just such an elegant solution. And it really speeds up the process of making vaccines so quickly. And this technology, I'm pretty certain will be used making influenza vaccines. Maybe finally we'll get a vaccine to prevent the common cold. God forbid there's another COVID that comes along, but really remarkable story in the middle of all this awfulness that we call COVID.